Okay, I'd like to first start by introducing myself. My name is Vincent Solomon. The other name is Aliama. It's very hard to pronounce. And the other colleague is Odongo Frederick, who happens not to be around at the time of recording. I'd like to extend my very sincere gratitude towards the role of Race for Us in inspiring the youth to go ahead with innovations and explore creativities in various aspects, health, climatic change, which foster sustainable development in the long run and encourage the youth to actively participate and use their creativity to solve day-to-day problems. I must say, looking at the subject we are sending the videos for, technological innovations, mine specifically addresses disease epidemics, and at that I'm looking at HIV/AIDS mainly, though it as well covers aspects of high burden public health concerns like TB and the others that come over time. This is not just a photo or video contest to me and my teammate. This is documentation of an innovation that we are working on currently and that seeks to address the major health concerns alongside consolidating the Millennium Development Goals. In specific, we are trying to consolidate roles 4, 5, and 6. MDGs 4, 5, and 6, that is infant mortality, maternal health, and combating HIV and AIDS with other diseases. The impact, the idea and the impact of this project and its goal is that we are holistically trying to address issues of infant mortality, reduce infant mortality, improve maternal health, and combat HIV/AIDS, TB, and the rest. And the reason why we want to look at it holistically, give it a holistic approach, is that you find that it's good to track patients, especially if you want to take care of women, their children, and HIV-related issues. You find there's a correlation between HIV patients and TB. Most HIV patients end up having TB, and if your mother is not healthy, there's a likelihood that it might affect the baby in delivery or something. So if you want to reduce infant mortality, you must see to it that the mothers are healthy from the offset. And if you're to see an HIV patient stay longer, you must ensure that other diseases like TB and the rest are worked on and that they are constantly followed to see that their health is at the best. You would agree with me that besides knowing TB and HIV have patients that have to live their life by the book. That means if they are taking ARVs, they should be consistent and taking ARVs. And for TB patients, they have to take their drug prescriptions faithfully and follow it to the doctor, because if they don't do it that way, it might not heal the disease, or it develops disease resistance towards the specific drug they are administering. And this means that such patients have to be tracked and followed up day by day to see that actually they're healthy and they're living normal lives. The description of this innovation, before I go to the innovation, the description itself, this innovation we're working on is called Antenatal Truck. The reason we call it truck is that it seeks to follow and monitor patients. Those are the TB and HIV patients. And how we monitor and follow maternal mothers is that we look at them from antenatal stage, from the time they conceive, they go to the hospital, to the time of birth and the rest post-antenatal, where they have services like family planning and the other guidances that we give them to stay healthy and happy. along the way. I'd like to proceed with the whole thing, that the description of the innovation is that our innovation has mainly two users. Those are the web users, the people who use the internet mainly to access the portals where they get support. And the other users are the mobile users. But why mobile is because we know Africa runs on mobile, and in Uganda we know over 20 million, 10 million for MTN and Airtel, and the rest also boast over about 10 million. So we are looking at about 20 million people who are subscribed to mobile, and this offers a cheap technology to reach rural areas where otherwise you would not have health facilities to guarantee the health of the people in the area. The other users we have on the system are the NGOs, the people in the health sector. We're looking at partners in HIV prevention and control treatment. The organizations like Mild May, Sustain, Vela Uganda, MJAP, Walter Reed, that are focused towards child health, would be our partners in seeing that people who are diagnosed and known to have HIV or TB then can be directed to supportive organizations which either give them ARV treatment or something to see their livelihoods are sustained or in a way or so. Briefly, if I'm to go to the purpose of this, before I talk about the purpose, I would like to mention something little about how this works. Text works for basic phone users. I'm looking at a person who owns a phone like this. This is not a smartphone, but can aid communication through text. What people mainly need are information that will save their lives. For instance, how to stay healthy during the times of pregnancy, how to calculate your pregnancy period, expectant day time, how to monitor your health history and give feedback, especially today, you know. For instance, if a mother comes and says, today my baby is not playing, you send a message to a random doctor and you get feedback through text that, okay, this is this. And then for the HIV patients, they get reminders on if they're supposed to take their ARV in the morning, by 8 they receive a SMS saying, hey, follow up on your dose. And they would quickly remember that they have to take their dose at that time. Now, I'll switch straight to the purpose of this. I said briefly, the purpose, if I'm to bullet it up, is the purpose of this is to follow up and monitor patients, TB, HIV, and antenatal mothers. And the other bit is to follow up and monitor support level to HIV patients, where they pick ARVs to see that the ARVs are actually there in the hospital to serve them, and address other needs as well. Now, I will fast forward and talk about the areas this innovation actually addresses. It helps to bundle up the MDGs 4, 5, and 6, and collectively helps to solve the problems. It comes handy for HIV. With HIV, we are basically looking at eliminating or minimizing mother to health transmission. We know we have campaigns of stay healthy, use this, but our challenge today is not to heal the existing HIV patients, but to keep them staying longer, but to prevent new infections in a way of seeing to it that the mothers get information on how they can deliver their babies safely without contracting the disease. And so it is handy for them to benefit from such information, constant reminders to see that we don't have new HIV infections resulting from mother to child transmission or something. So we want to eliminate that clause and see that the ones who are already infected live longer to support their kids, and then the other kids are reliably followed up after birth, that they get immunized and they stay healthy in the long run. And outside this, this also gives us the opportunity to have a disease surveillance and reporting thing, strengthening the E and M electronic and mobile arm of medicine, which helps in disease diagnosis, which helps in health history tracking. For instance, for the antenatal, we have the mother's passport that gives a brief of their health history. Also, it helps in synchronizing the various databases and trying to foster some level of support for them. In that, if a mother today has HIV and it's known, and then this same database is shared with support-giving organizations like MDGs, for instance, and they know we have these people, we must give them ARVs, and they remind them about the ARVs for them to stay healthy also. And as well, the mobile platform helps to reduce the doctor-patient ratio, because these people are basically interacting through text. And so if a patient has a problem, they should be free to send it to a doctor, even when they're in remote areas. This is the only way we can reach village areas with no health centers with support on antenatal information. Because antenatal is basically about care, risk assessment and prevention, and then I don't know what the others are. That comes to someone having his whole 9 months shared along 3 trimesters, period of 3 months each, that the child undergoes specific developments in. So they need to know at this stage what to expect, and this information can be given through text. For the low-end feature phone users, and the smartphone users could have an Android or WhatsApp equivalent where they can give advanced problems through picture messages or having rather bulk and elaborate text messages. That will only support the high-end phone users who are using smartphones. In line with the strengthening the electronic end and trying to electronic end approach to having a synchronized patient database, there's quite a lot we can do, especially drug administration from different hospitals, and know their health history and what they've been treating what their diseases on. We all know that we have problems existing in the health sector that this solution will help address, like high patient-to-doctor ratio, HIV mother-to-child transmission, poor maternal health and antenatal health, and absence of disease surveillance or reporting center, lack of coordination between HIV patients and to support organizations like MDGs and the rest, few health centers, high costs of private healthcare units, and that relates to doctor consultation fees and the rest, which would be minimized on a mobile or text platform, which makes it free. So this solution gives them SMS monitoring, finding a doctor, other resources as well. The market size we're looking at here is about capturing about 85% of the mobile subscribers, mainly targeting public health hospitals, the government or the referral hospitals in different regions. This provides our catchment in the market size. And the scope for this, that would like to roll it out in central Uganda first, where we have our main national referral hospital, and then we can slowly spread it out to other hospitals. The business mode would be having it free for referral hospitals, because they are the target population, they are the poor who need this. And then private individuals would be asked to subscribe to the site and know how they can get support from that. We have different clients in mind, and others self-enroll themselves to the system. And I mean, I know I'm positive, I can share the details. I go to the website, I register myself, say I'm positive, I have this, and then someone else follows up by giving me the right information on what ARV, what my CD4 count is, what ARV I should be taking, and they remind me regularly on my mobile, telling you, hey, it's 10 o'clock, you must be taking your ARVs. And this is how you would live long, even when you're positive with the disease. I would not go much into what we have to do in terms of what we require to finish out our project, but I'll briefly say it's already in progress. We're working on the web end and the mobile as well. And I would like to take you shortly to explain a few things about what is happening on the web, though it's not fully developed, but you may care to take a look at what happens on the web. We have a home page which talks about antenatal care. With this, here we discuss aspects general about our antenatal care that is open to everyone who sees, who visits the site. And there's a portion where you can find antenatal unit near you. These are probably private hospitals in different locations who are using our systems, who can give you support, who have numbers of doctors you can write to directly about your health concern if you're a mother. And then this bit is the self-enroll, HIV self-enroll, where an HIV patient can enroll himself to the system, and depending on his concerns, he can get feedback in form of SMS and get addressed. The other side will have to look at patient resources, mainly in line with where to go, what to do. The research bit indicates different aspects or behaviors of the disease that are recorded that helps in drug administration and the health history bit. And more in antenatal, we hope to have a soft way of having an equivalent of a mother's passport, which gives their health history, health background, which is critical in antenatal as well. So what happens is a patient has a sign-up where they enroll, and where they enroll, the sign-up gives them access to the system. They log in, they have a username and password, which is confidential to them, and they can interact with the system and the doctors and the rest. So this provides more or less the web end to the project, and then there's a mobile side, which of course would be text, and probably a WhatsApp group and a WhatsApp application that gives them daily guidance, especially for antenatal, on issues to do with baby development, or day one, what do you expect, week one, what do you expect. So as soon as they sign up, they get such reminders through email and through text. And once again, I would like to thank you so much for this opportunity, because it then gives me a platform to explain what is burning in me and where I need support to see that the health issue in Africa really is solved. Like our slogan goes, the future of Africa, according to me, is conceived in the bellies of our mothers. So when you take care of them, you'd have healthy babies and a healthy society. Thank you very much for your audience. I remain Vincent Sula.